Welcome to Active Healthcare, a place to share medical knowledge and provide comprehensive healthcare tips to help you live a healthy and happy life every day. In the previous video, we answered the question, how to detect kidney stones early. In today's video, we will explore the 6 most advanced kidney stone treatment methods available today. Before treating kidney stones, we must first address an important question. What is the size of the stone? The size of the kidney stone is a key factor in determining the appropriate treatment plan. Small stones can sometimes be passed naturally through physical activity, like jumping rope or jogging. However, larger stones, or those that have formed over time and have irregular shapes, can cause complications such as narrowing of the urinary tract, making it difficult to expel them naturally. In such cases, doctors will recommend specific treatments to address the stones effectively. Here's a breakdown of treatment approaches based on stone size. Stones less than 4 mm, about 80% of these small stones will pass naturally within 31 days without the need for medication. Stones between 4 to 6 mm, around 60% of these stones can be excreted through the urinary tract over a longer period, 45 days or more, but medication might be needed to assist the process. Stones larger than 6 mm, natural excretion occurs in only about 20% of cases. In these situations, doctors typically prescribe medication to help clear the urinary tract and facilitate stone passage. Stones around 1 cm in size. If imaging shows the stone is not too hard, doctors may recommend extracorporeal shockwave lithotripsy, ESWL, a non-invasive treatment that breaks the stone into smaller pieces to reduce the need for surgery. Stones around 2 cm or larger. For larger stones, doctors will assess the situation and decide on the most suitable treatment. Options may include laparoscopic surgery or open surgery to prevent serious complications. By determining the size and location of the stone, doctors can choose the most effective treatment option to ensure the best outcome for the patient. In principle, kidney stone treatment aims to achieve 5 goals in order of priority. Maximize the function of organs, not just the urinary system, but also other related organs. Limit pain for the patient. Ensure patient safety. Remove as many stones as possible from the body. Optimize costs. Based on these principles, here are the treatment methods for kidney stones, arranged from least to most invasive. 1. Internal medicine treatment. If your kidney stones can be treated with medication, congratulations. This is the gentlest method. It's painless, non-invasive, and doesn't require hospitalization. This approach is suitable for small stones, typically less than 1 cm, with no complications such as urinary tract infection, urine retention, or severe pain. Doctors will prescribe medication to help clear the urinary tract, making it easier for the stones to pass naturally. Depending on the patient's condition, doctors may also prescribe antibiotics and pain relievers to manage discomfort when the stones move. 2. Extracorporeal shockwave, lithotripsy, ESWL. This is a non-invasive surgical method that uses shockwaves to break up kidney stones into smaller pieces, which can then be passed through the urine. Procedure. The patient is placed under general or local anesthesia to avoid pain. The body is positioned so the shock waves can target the kidney stone through a water-filled cushion or other support. About 1,000 to 2,000 shock waves are used to break the stone into fragments over 45 to 60 minutes. After the procedure, the stone fragments will pass naturally through urination. Antibiotics and pain relievers may be prescribed, and patients are typically discharged after a few hours of observation. Advantages: non-invasive and painless. Quick recovery. Patients can go home the same day. moderately priced. Disadvantages: effective for stones less than 1.5 cm. For larger or harder stones, multiple sessions may be needed to break the stones completely. Note: patients are advised to drink plenty of water and use a filter to collect the stone fragments for further testing. 3. Retrograde endoscopic lithotripsy. This minimally invasive method involves using an endoscope to remove stones through the natural urinary pathways. A ureteroscope is inserted through the urethra, bladder and ureter to the location of the stone. Indications: patients with ureteral stones that are unsuitable for ESWL, patients who had failed ESWL or who have recurring stones or ureteral narrowing after previous surgery. Procedure: the patient is placed under general or epidural anesthesia. The surgeon inserts the endoscope into the urethra, through the bladder and up to the ureter. Specialized tools are used to crush and remove the stones. A JJ catheter, a tube with two J-shaped ends, is often placed to ensure proper urine flow from the kidney to the bladder after the procedure. Note: this method is not suitable for patients with blood clotting disorders, urethral strictures, especially in males, severe urinary tract infections, or severe hydronephrosis. For stones located in hard-to-reach areas, such as deep in the renal calyces or in bent positions, a flexible endoscope can be used to maneuver into these difficult areas. Post-surgery care. While this method is considered safe, patients should monitor for signs of complications such as lower back pain, blood in the urine, or genital pain. If these symptoms occur, they should return to the hospital for examination. 4. Percutaneous nephrolithotomy, PCNL. Percutaneous nephrolithotomy is a highly effective and minimally invasive surgery for the treatment of large kidney stones, typically ranging from 1 to 2 cm in size. It offers a high success rate for stone clearance with minimal pain and usually requires only one surgery. Mechanism: unlike retrograde endoscopic methods, where instruments are passed through the natural urinary pathway, percutaneous nephrolithotomy involves creating a small incision in the patient's back to access the kidney directly. Through this tunnel, an endoscope and lithotripsy device are inserted to crush and remove the stones. Procedure: the patient is placed under anesthesia. A small catheter is inserted through the urethra, into the bladder, and then into the kidney. The patient is then positioned face down, and the surgeon uses X-ray or ultrasound guidance to puncture the kidney with a needle. The puncture is gradually widened with a guide wire and large tubes to create a tunnel directly into the kidney. An endoscope is inserted through the tunnel, and the stones are broken into smaller pieces using a laser, ultrasound, or pulsed energy. The fragments are removed using suction or forceps. A temporary drainage tube is left in the kidney, and the surgery is completed. Advantages: almost all stone fragments can be removed in one surgery. The procedure is relatively painless, short hospital stay and preservation of kidney function. Disadvantages: though minimally invasive, there is still some damage to the kidney parenchyma, but it's generally minimal due to the small incision, not suitable for patients with extremely large stones accompanied by urinary tract infections. Notes: patients must inform their doctors about existing implants, medications, especially blood thinners, or conditions such as infections or endocrine disorders. Preoperative discussions with the doctor about anesthesia and pain relief are also important. 5. Laparoscopic surgery. Laparoscopic surgery is now less commonly used, as percutaneous nephrolithotomy offers better results with fewer complications. However, in certain cases, laparoscopic surgery may still be employed. Advantages: stones can be removed immediately, and the cost is moderate. Disadvantages: there is a higher risk of kidney damage. Patients must stay in the hospital for several days, and recovery takes longer. Not suitable for patients with a urinary tract infection. 6. Open surgery. Open surgery is reserved for cases involving very large kidney stones, often over 2 cm, and may be necessary if there are complications like pyonephrosis, infection in the kidney causing pus accumulation. Procedure: the patient is placed under general anesthesia. The surgeon makes an incision along the lumbar rib on one side of the hip, accessing the kidney or ureter through the retroperitoneal space. The renal pelvis or kidney parenchyma is open to remove the stones. All stone fragments are carefully aspirated to ensure complete removal. A drainage tube is placed in the ureter to help drain urine from the kidney. The incision is then closed, and a compressive bandage is applied to complete the procedure. Post-surgery care. Patients will need to stay in the hospital for a few days. Full recovery and wound healing typically take 4 to 6 weeks. Advantages: complete removal of stones in one surgery, making it ideal for large stones. Suitable for patients with urinary tract infections such as pyonephrosis. Disadvantages: as this is an open surgery, the risks are higher compared to minimally invasive methods. The procedure can leave scars and reduce kidney function by 20 to 30%. The recovery period is longer, requiring weeks to heal. Complications of kidney failure due to improper treatment. While kidney stones are common and can be treated effectively, improper or delayed treatment can lead to serious complications, including kidney failure. In severe cases, patients may need to rely on dialysis or face the removal of a kidney. Causes of kidney failure. Complications: delayed detection and treatment. When stones grow too large, they can block the urinary tract, causing kidney function to decline. Undiagnosed stone movement. Stones moving through the urinary tract can cause infections if not properly diagnosed and treated in time. Self-treatment or improper medication use. Patients who do not seek professional medical advice and instead rely on self-treatment may end up with kidney failure or damage to other organs. Incorrect medical treatment. If kidney stones are treated improperly, this can lead to damage in the urinary tract, resulting in complications such as infections or permanent kidney damage. Above are the 6 most advanced and modern kidney stone treatment methods today, listed in order of priority and with the least impact on the body. If you are currently undergoing treatment for kidney stones, it's crucial to consult with a specialist for a comprehensive examination. Be sure to provide your doctor with full details about your medical history and any medications you are taking to avoid any complications during treatment. Wishing you good health. If you found this video helpful, please share it with others who might be dealing with kidney stones. Don't forget to subscribe to our channel and turn on the notification bell to stay updated with more videos in this kidney stone treatment series.